Okay, we're live now. Alright, let me get everything ready. We'll get started. Okay, so this live is going to be about a diagnosis called fibromyalgia. Now, fibromyalgia is something that is more recently been diagnosed amongst researchers and among the physio community. And its definition is chronic pain all over the body that can be associated with a range of other symptoms that include poor sleep, fatigue, depression, and a lot of what we would consider yellow flags that our clients would come to the clinic with. And it's dealing really is quite debilitating for them in their day-to-day. And our understanding of fibromyalgia has increased substantially in recent years as with a lot more extensive research that it suggests it's more of a neurogenic origin, meaning it's coming from the nervous system in the body, the central nervous system, going to the peripheral. And the neurogenic origin is the most prominent symptom of fibromyalgia, which then constitutes chronic widespread pain throughout the body. Now, there's no sort of clear mechanism for fibromyalgia that we know of, but evidence suggests that there is an abnormality in the central pain processing of your body and your brain. So if we're going to get to the background of it, so we're going to get to try and understand it at the molecular level, and hopefully from there you can get a better understanding of it as a whole. So what it comes down to is neurochemical imbalances in the CNS, the central nervous system, that's associated with amplification of pain perception. So you know pain is that amplification can be characterized by what's called two things. There's allodynia and hyperalgesia. Allodynia is a heightened sensitivity to a stimulus that's not usually going to be painful, and hyperalgesia is an increased response to that painful stimulus. So in normal pain processing, the perception of pain involves two main pathways, the ascending and descending pathways, and what happens is these nerves transmit sensory signals. I won't get into the nitty gritty of it, but it sends sensory signals, including nociceptive signals, which is a fancy word for pain-inducing signals, to the spinal cord, and then it transmits that to the brain for processing. Now, normally, these are done, they're done linearly, there's no issues with that, but with fibromyalgia, the two main pathways operate abnormally, resulting in central amplification of pain signals. So as a result, I mean, this is not entirely counted as fact based on evidence. However, this is what we current research is leading towards, that they're saying that it's more of a amplification of pain, and as a result, people with this condition have what would be considered as central sensitization, and now what we would then consider it to be as amplification of pain as a whole, and that's what people with fibromyalgia are dealing with. Now, this is something that I've had to think about diagnosing with a few patients that I've seen over the last month, and usually to come to that conclusion, you're looking at clearing other forms of unremitting pain-inducing things. You want to make sure there's no indication of any form of cancer, any metastasis. As with that, you also want to make sure that if there is some pain that can be explained, that isn't throughout the body but in a specific area that can be explained by acute injury or anything like that, then it's less likely for it to be fibromyalgia and something that's more indicative of that specifically. But it doesn't mean that there isn't fibromyalgia in those people as well, because they could be experiencing pain at a heightened response compared to normal people. So it's important to understand that with what we understand with this, it's a lot to do with the neuropathic pathways in the body, and that's what we're thinking about now in current research. Now, and for those who have this, there are some main contributing factors for that. The number one, it likely is the genetic factors that come with it. So researchers have found that fibromyalgia has a strong familial component, with first-degree relatives displaying an 8-fold greater risk of developing fibromyalgia compared to the general population. In addition, family members are more sensitive to pain than controls, and more likely to have co-occurring pain disorders such as IBS, TMD, headaches, or other regional pain syndromes. So, what we know with if that is something that's in your family, then you're very likely to get that as well. And the usual demographic for that would also be with middle-aged women. We see that usually being the case, and epidemiological studies suggest that that's the demographic that deals with it the most. It doesn't mean that it can be outside of that, but it's more likely to be in that group. So another factor that isn't, genetic is something that you can't control, right? But other factors that you can control, to an extent, is stresses. So we know that with chronic pain syndrome, disparate stresses can trigger the development of these conditions, and in research, human stress response has been closely examined as potentially causative role in that. Stress responses are mediated primarily by the endocrine system, by releasing a hormone, and what we've seen in studies, there's an elevated amount of this hormone shown to be linked with increased symptoms with the fibromyalgia that we mentioned at the start, with depression, fatigue, sleep issues as well. And it's important to know that these stresses can be as much physical as they can be psychological, and both can affect the endocrine system as a result. So, if you have sustained an injury, then you're more likely to be induced to high amounts of stress, and then the stress then can increase pain. So we know that that's the case. So that's why it's so important to monitor stress, whether that's psychological or not, as it gives us a good idea of prognosis. So we know based on that the likelihood of someone having fibromyalgia is higher. Now, that when we're talking about physical and injury-related stresses, the psychological can be to do your daily living. So if someone is very highly stressed with anxiety, depression, and a bunch of other stresses that can induce this, we know that it's likely that fibromyalgia is the diagnosis for them as well. And it's important that we monitor this and try to reduce this as much as possible. And that leads me on to what we would see as an associated condition with fibromyalgia. Is we need to understand that it's not a diagnosis of exclusion. So we're not saying that nothing else occurs, but if nothing else occurs as fibromyalgia, it often occurs in patients with other conditions such as inflammatory arthritis, osteoarthritis. Another is TMD, just temporomandibular disorder. It's a condition you've got pain in the jaw, cheeks, ears, and temples, just pain in this area. And that's something that I've actually seen recently with a client as well. So it means that if you have fibromyalgia, you could have a host of other chronic debilitating conditions as well as that. Now that we understand what it is, what the causes are, we can then move on to the treatment. So when it comes to treatment, and as I mentioned before, the symptoms of fibromyalgia are very multifactorial. So there's multiple. So one person might have a fibromyalgia displaying different forms of symptoms compared to someone else. So we know as a result of this, there's no one form of treatment that's the best. The progress in the understanding of fibromyalgia has led to more therapeutic options for patients at the moment when it comes to medications. But investigators conclude that utility of newer medications and non-pharmacological interventions are still in the process of being understood and in controlled trials at the moment. It used to be the thought that exercise might worsen fibromyalgia or accelerate the disease. So over 20 years ago, doctors encouraged patients to seek rest. It's not to not do any activity whatsoever. But more recent scientific studies have shown that for most patients, working through range of motion in the joint that's painful, let's say, strengthening the local area, and aerobic conditioning, which means cardiovascular exercises, are safe, and not only safe, but they're necessary for general function and decreasing the perception of pain. Now, it's important to realize it's perception of pain because a lot of it, when it comes to hyperalgesia, is you perceive it to be higher, which was trying to reduce that for that person. We can't stop that from happening, but we can reduce the amount of pain that they feel. That's important, especially as a form of treatment. So studies showing that exercise can help to restore the body's neurochemical balance. Now, as I mentioned before, it's the endocrine system when it comes to stress-related hormones. That's because things are out of balance with people with fibromyalgia. So you want to exercise to reduce this as much as you can. And when moving on from there, it's only, not only does regular exercise slow down heart racing, adrenaline that's associated with stress, but also boost levels of natural endorphins. Now, endorphins are great for they're considered pain-fighting molecules. They can numb pain quite substantially. So you might have heard of what's called like a runner's high, for example, and we know that this is can be the case with aerobic exercise a lot more than strengthening exercise, and that sort of matches with research as well. We know a lot more towards cardiovascular exercise, but strengthening isn't too specific. When it comes to aerobic exercise, straight away we know that that's the most beneficial in terms of exercise for these clients. So just to get up and moving, get going, get the blood flowing a lot more is going to be more beneficial to reduce your pain. And what we know about endorphins, it helps reduce anxiety, stress, and depression, which are all symptoms that are linked to fibromyalgia as well. So to conclude with treatment, medications can be beneficial, but if we're looking at conservative methods, just getting up and moving is going to be a great start. Now, it doesn't mean that just because you have fibromyalgia doesn't mean that you don't have other issues that are going with that. For example, if you are highly stressed, it's likely that you're working in a desk job, for example. Let's use that demographic as an example. Then it's important to make sure that you're strengthening the areas that are lengthened during that time. Slouching, etc. It's not going to be beneficial for decreasing pain. So when it comes to exercise, that can be beneficial. Strengthening, not directly related to reducing pain, but improving someone's posture as a whole is another thing that we have to consider. Again, not so concrete as compared to cardiovascular exercise, which we know works the best. So in conclusion, any form of activity is better than no activity, and that's what we want to do in terms of treatment going forward for that. So beyond that, that's the background on fibromyalgia, the contributing factors, the demographics that are affected, as well as associated conditions and treatment. So that gives a broad spectrum on this particular diagnosis. And if there is some pain, if you're getting a lot of pain throughout the body, and you have these other forms of symptoms of high stress and depression, then do seek medical help for that. And hopefully, once you recognize those conditions, it's important to be educated on this and deal with the pain accordingly and deal with the stresses accordingly. So there you go. Hopefully that all made sense, and I will leave it there.